In celebration of National Community Health Center Week, the Alameda Health Consortium and the Community Health Center Network extend our appreciation to all clinic staff. While some individuals are receiving special recognition today, we want to congratulate all of you for your dedication and commitment to community-based health centers and the health of our communities. This reception is in your honor.
Our first appreciation award goes to our board member, Ms. Stephanie Riddell, who has been on our board for 39 years and 7 months. Last year, Stephanie, we saw your experience in action as a nurse, come to the table juggling your schedule between 2 hospitals, watching your international traveling, and the time you've spent enjoying your family. You've always been a steady voice of the founding mission to provide affordable family planning to women of color. Stephanie, thank you for being an aid to the new board members, to help their understanding of the last 44 years of history to get here. We want to recognize you, Stephanie, for being present and your participation in this phase of our journey. Another Stephanie we want to recognize is Ms. Stephanie Mahuse. In the referrals department, Stephanie, we know that your current duties go far beyond the job description and involves assisting new staff and patients in understanding what Affordable Care Act really means in our daily workflow and their linkage to specialty care. Your attitude of can do, make it happen now has been absolutely contagious. This last year, Stephanie, we saw that you stood tall during your department's relocation to a different site, the change in supervision, system upgrade. Stephanie, we want to thank you for being part of this team at this time on our journey. This next acknowledgement goes out to one of Tri-City's senior physicians. I say senior, it's not just the 21 years that you've provided services at Tri-City, but giving advice for the patient care workflow and serving as the interim CMO not once but twice. This last year of transformational change, Dr. Mulgrew, your voice was loud and heard in policy changes and a smoother integration of services. And sharing the excellence in clinical service is Dr. Puri, who recognized the hard work as being a clinical director of one of our busiest locations, the Maori One Clinic. You've distinguished yourself through various staff meetings with board, with community, insisting on accountability and patient-focused service delivery. Thank you, Dr. Puri. And for all of us, I say, I am Tri-City Health Center.
I am Tri-City Health Center.
सत श्री अकाल, मैं ट्राई सिटी de काम करती हूँ.
NA Tri-City Health Center.
Ma Tri-City Aston.
Yo soy Tri-City Health
Ni ahe Tri-City Health Center.
我们是 Tri-City Health Center.
Ade hai Tri-City Health Center.
मैं हूँ Tri-City Health Center.
Chris Bakasum has been with the organization for over a year. He comes to Native American Health Center with a tremendous commitment to the community and also to his colleagues. He has tremendous integrity. He's always willing to test new pilots for us. He arrives 1 hour early before his clinic starts so that he can ensure a good beginning of the clinic and also make sure that he's completed paperwork in less time than the providers are required to do so. He's very helpful and loves to teach his medical assistants and makes them feel part of a team. So we're very grateful for his services to our members and commitment to the community. The department that we want to acknowledge this year is our dental department in Oakland. And we wanted to acknowledge the fact that they not only care about the members and providing great services, but also how to be a successful business for the organization. This year, they've been expanding Saturday clinics to make sure that they're seeing additional members. They see members twice a month. They have also increased their revenues. They've expanded the satellites that they provide services in. And also they have brought in specialty services into the organization, such as ortho, oral surgery in-house, and they are very team-oriented. So for this, I think it's a well-deserved honor. Dawn Lulua Claxton is a compliance associate. As compliance associate, one of the responsibilities she has is to develop and maintain an emergency preparedness security program. And Dawn leads that, and the organization has never been as in compliance as in the last year. We are up to date with all our trainings. There have been over 106 trainings that have been done during the year. She's developed a committee that oversees the entire program, making each department accountable for their own plan. And staff is well prepared for any emergency at this point, and the organization is in compliance. So for that, I think she deserves recognition, and we want to acknowledge her services.
Vicki Stewart is one of the Council's superstar medical assistants. She has been with the Council since 1993. Vicki has worked at all of the Council's primary care sites. She currently is working at our A.J. Thomas Clinic and is working as the clinic lead. Vicki takes care of business by making sure the patient experience is an awesome one. She believes in putting the patient first and strives to get the patient in and get the patient out, all while having a pleasant experience. Vicki really likes her co-workers and being part of a patient-centered team. She loves helping the community and especially working with the elderly patients. She realizes that sometimes they need additional time and assistance. Vicki has patience with the patients. Congratulations, Vicki Stewart, clinic lead and medical assistants, for your outstanding support in patient care. It's because of employees like you that patients continue to return. Marquita Johnson is the Council's lead referral coordinator. Marquita is part of a team that provides coordinating support to the referral process to ensure quality control on referral process through tracking and other supportive measures that will ensure referral process completion in a timely manner. Marquita is a rock star when it comes to referrals. Marquita has been with the Council since 2012. She has a $1 million smile and a magnetic personality that makes you want to be associated with her type of charisma. Marquita also wears the hat as an administrative assistant to the chair of the Committee on Quality Improvement. Marquita stays busy all day, every day. Marquita has gone above and beyond my expectations as her supervisor. She has created and maintained a functional and successful referrals department. For your outstanding work in the referral department, the West Oakland Health Council salutes and recognizes Marquita Johnson. A picture is worth 1,000 words. This photograph is of Ms. Clotilde Davis signing the check from the federal government for West Oakland Health Council to begin its delivery of health care. Mrs. Clotilde Davis is an original board member of the West Oakland Health Council. As the Council gets ready to celebrate its 50th year anniversary, we couldn't help but to reflect on her contributions as one of the founders of our clinic. Everybody knows Mrs. Davis. She is respected in the community and has watched generations of families grow up and receive care at the West Oakland Health Council. There isn't any way possible that you can talk about the history of West Oakland Health Council without mentioning the name of Clotilde Davis. The employees, the patients, the entire community is grateful for the work, the commitment of Mrs. Clotilde Davis. We are proud to honor her legacy as a founding member of the West Oakland Health Council. Congratulations, Mrs. Clotilde Davis.
Everyone has a right to quality health care, regardless of their sexual orientation and gender identity. The LGBTQ Alliance at Asian Health Services was formed in 2009. The Alliance developed the first of its kind LGBTQ medical glossary in multiple Asian languages to help providers and clinic staff in providing care to the culturally diverse LGBTQ patients and their families. In response to the Orlando shooting, the Alliance called upon AHS to have a collective moment of silence and to put out a public statement from a community health center condemning discrimination towards the LGBTQ community and gun violence. We at Asian Health Service are so proud of the Alliance and celebrate their work to bring greater awareness and sensitivity towards LGBTQ patients. Thank you, Alliance. Tervina Moy has been chairing the Consumer Board Committee and advocating on behalf of patients and their needs at Asian Health Services. She has been meeting with all 7 patient leadership councils, a signature of patient involvement at the clinic. She has designed and implemented a train-the-trainer program for our diverse patients on advanced directives. In it, she shared her personal experiences and her motivation for why patients should consider having an advanced directive for themselves and their loved ones. Tervina has made tremendous contributions to AHS in her work to ensure that patient needs are voiced and addressed. We want to now call upon all of you to help us honor and appreciate her for always going above and beyond the call of duty. Thank you, Tervina.
We are all so proud of our AMC Pediatrics Department. They are a close-knit unit who tirelessly serve the children in our community in 8 different languages. They so often go above and beyond the call of duty to help our children, such as writing letters to landlords about the living conditions for children with asthma or advocating for kids with special needs at school. They have also developed strong community partnerships, collaborating with organizations like Help Me Grow, Reach Out and Read, and Asian Community Mental Health, in order to meet the behavioral and developmental health of kids. This all speaks to the desire of the department to take care of not only the physical needs of kids, but the emotional, environmental, developmental, and educational needs as well. We want to recognize the PEDS department for their hard work. They truly deserve this award for Outstanding Department at AHS.